Good morning, everyone. We are here at GISE conference in Milan. My name is Valeria Paradies, and I have the pleasure to interview today Professor William Wijns. He's Professor of Interventional Cardiology in Ireland and co-director of PCR course and the very first president of the APCI. So we had a session yesterday. There was a joint session, GISE-EAPCI-PCR. And we talked a lot about TAVI implementation. What could be the societal role for adoption, more adoption, and actually wider adoption of TAVI?
Well, thank you. Indeed, it was a great session.
It was.
The title was about obstacles, but in
Yes.
fact, we ended up talking about solutions and sharing of best practices. And, if you make a list of obstacles, the first one is awareness in the community and also in the medical non-interventional field. It looks like, we made a lot of progress after 10 years of TAVI. So that it didn't seem to be a major issue.
Okay.
Then there is, of course, the issue of capacity and access. And here it will be important, and that's the role of societies, to your questions, to map the capacity so that we can identify areas where we have inequalities in access.
Correct.
That should be the focus of intervention.
Yeah, and that's actually a really, really hot topic, tackling disparities, geographical disparities as well. What would be the role of the society in that? What do you think about?
Well, I think that the societies can help in mapping the situation so that we have numbers.
Okay.
And if we look back at the implementation of primary PCI for STEMI, that's exactly how we have achieved coverage of large territories that were before that not accessible to patients. Then there is, of course, the capacity building in-house.
Yes.
And implementing the guidelines, the ESC guidelines, where we had some interesting suggestions. For instance, the central role of a TAVI coordinator.
Mm-hmm.
It's a bit like in other chronic diseases like diabetes or cancer, where very often there is a coordinator that is the central anchor person for patients, for referring physicians, and also within the institution to make sure that every patient not only gets a fair treatment, but gets the best treatment.
Yeah.
And that was an interesting suggestion from some of the participants in the program yesterday.
Okay. And when we talk about, I think the ultimate goal would be standardization of the procedure, and I think the education could really play an important role in that. And as a co-director of the PCR course, where do you see the role of education, for example, use of simulators for indeed young interventional cardiologists, and thinking about also actually tackling these disparities, the geographical disparities, for example, for using these courses actually as a tool to implement education also in remote areas. What do you think about that?
Well, thank you for the question, because it sort of describes the brand of PCR.
Yeah.
We are working at the level of the community globally with the help and collaboration of scientific societies, particularly GISE, for many years now. Education is central, and there is new ways to learn. I think just watching it and then trying by yourself is probably not ideal. That's why we're really focusing on simulation-based training for new procedures, but also for existing procedures, because as you said, there is the next gen.
Yes.
You know how many colleagues come for the first time each year to PCR? It's 40%.
Okay.
So the refresh rate is amazing. And the teachers sometimes get tired. They say, well, I've shown this last year. No, please do it again, because there is many new colleagues who need to learn about it. So that is central. During the session yesterday, there was also an emphasis on training of the entire team, not just the doctors. And one interesting suggestion was also to cross-train the team members, the physiologist, the radiographer, the nurses, but not just the nurses from the cath lab, the nurses from the ward, the nurses from operating rooms, so that you create a heart team at the level of the field, and not just, the big names.
Just one person, indeed, and that's actually also facilitate and streamline the procedure if everybody's involved and you have indeed a really strong supporting team in your cath lab. So yeah, I really enjoyed the session yesterday, and I want to thank you again, because your presence here is really important for GISE Society, and you have been actually really close to the society for long years. And we hope to continue on this path with the collaboration and also with the PCR course as well. And looking forward to see you again next year.
Thanks very much for having me.
Thank you.